Good day, fellow learners. This is your mentor, your fact check buddy, joining you for our MGN pointers set number 28. So, at this point in time, I'd like to share with you certain things that I know you would be so glad that you listened to me, because without knowledge of these concepts, the MGN test that you're about to take could be very, very challenging. Okay? So, the most important thing now is stay focused and listen intently as I share with you trending concepts. Let's begin. So, before we proceed to our NGN pointers, set number 28, let me just ask you this question. Do you know what are the things that you need to study or to focus on? You need to get an expert opinion. And at the Ray A. Gapuz test preparation system, we provide you with very competent, very young, and very able mentors who are trained on our specific success recipe for the NG and NCLEX. And that's going to be your functional concepts method. Okay, so let's begin with our first NCLEX NGN alert. And that's going to be melanoma. Now, when you say melanoma, how do we explain this to our clients? We would need to tell our clients that melanoma is a form of cancer that affects the cells that color the skin. Now, the question is, what are the common risk factors? Remember the code WHAT? WHAT. So W, this occurs when a patient has a weak immune system. H, there's history in the family. A darker skin like Hispanic clients, or a lighter skin like those who are in Northern America, or the blonde, or the Europeans. And of course, T, tanning lumps, especially those who would want their skin to be tanned, or direct sun exposure, especially those who love to go under the sun and do a sunbathing between 10 a.m. to 3 p.m. So, how would we know that a patient indeed is suffering from melanoma? First, you need to assess for A, B, C, D, E. Now, A means there's a symmetrical shape of the mole that could be found either on the face, on the arms, on the legs, or even on the palms and the soles of the feet. Okay, so these are important to note, especially when you're assessing a patient with melanoma. The second important thing that you have to assess: A, remember, a symmetrical shape. B, border that is irregular. So it's not properly bordered. The shape could be irregular. And C, the color is variegated. When you say the color is variegated, the color is not consistent. There are areas in which the color could be darker. There are areas in which the color could be lighter. And D, diameter. So it's usually larger than 1/4 inch, or larger than the eraser of a pencil. And then E, it evolves over time. So what are therefore the things, on the other hand, that would tell us that the mole could be normal? Well, one, the size could be smaller than 1/4 inch, or the eraser of the pencil. It could be bordered. It could either be oval or round. And you have to pay particular attention to the fact that there's no unusual sensation, there's no pruritus, or there's no change in how it appears, and the color is consistent. Okay, so when these things are present, it simply means that that mole could be normal. Okay, now treatment of melanoma would usually involve chemotherapy and surgery. So we need to remind our clients about the things that they have to observe while undergoing these types of treatment. Now, before we proceed any further, I'd like to tell everyone and to remind everyone that if you don't see us in your class, then it's not a Ray A. Gapuz system class. And who are these? Okay, so we have the Ray A. Gapuz mentors. We have Mentor Che, who is US licensed in New York. Mentor Francis, who is US licensed also in New York. Mentor Missy, who is also US licensed in New York. Mentor Shans, who is US licensed in New York and Vermont. Mentor Marisol, who is US licensed in New York and California. Mentor McLean, who is US licensed in New York. And Mentor Nicole, who is NCLEX passer and licensed in Ontario, Canada. And of course, yours truly, your fact check buddy, Ray Gapuz. That's me 60 pounds ago, rather. Okay. I am US licensed in the states of Illinois and Georgia. So let's pay particular attention now to what are the things that we need to remember in relation to our second NCLEX RN alert. And we're talking about polysomnography or sleep test. Now, your polysomnography is a diagnostic test that is non-invasive. It doesn't hurt. The test would usually take around 12 hours, and there are things that we need to tell our patients. First, the test does not involve, once again, it does not involve sedation. So no sedation required. It does not involve extraction of specimen for ABG, so it's non-invasive. And it will not monitor nocturnal penile tumescence or nocturnal erection of the penis, although it used to be part of the test. Now, no more. Okay? So on the other hand, what does your polysomnography include? So it includes your EEG. So it would give information about how your brain works while you're sleeping, specifically the brain waves. EMG, so the electrical activity of the muscles. That's your electromyogram. And then your ECG, electrocardiogram, your heart activity, including your heart rate. And of course, EOG, your electrooculogram, okay, meaning the eye movement. And it would also involve measurement of your oxygen saturation using your pulse oximeter, which is a non-invasive procedure, which means one of your fingers will just be attached to your pulse oximeter. Okay, so in essence, your polysomnography monitors the code BOBHEL. B, brain function. O, oxygen saturation. B, breathing. H, heart rate. E, eye movement. And L, leg movement. Okay, so this test would definitely be conducted while there are certain attachments to the body. So what will we tell our clients? First, there's going to be a specialized belt that is placed around the chest that would help monitor your breathing. Okay, and then of course, there's going to be stickers, or we call them stickers using layman's term, but these are actually your electrodes that are placed on the face, on the legs, and on the hand. And the most important thing that we have to reassure a patient about this test is that these stickers or electrodes won't hurt a bit. So once again, there is no pain in this test. So this test would help the physician diagnose the presence of obstructive sleep apnea. And don't forget, reassure the patient that the test will not hurt. Okay, so let's move on to the next thing that I'd like to share with you. Well, okay, here we go. Let's take a look at this inspiring story. She experienced magic that made her pass NJ and find out how. Read on. So this is what she wants to share to everyone. But first, let's congratulate Jean P. Villa from Universidad de Santa Isabel for passing the New York Board of Nursing last September 21, 2023. So this is what she wants us to learn from her. Taking the NCLEX for the first time was very frightening, especially if you don't know where to start. But with the guidance of my agency, they paved the way for me to know Ray Gapuz review system. They let me take the chance to experience the magic of Sir Ray. What is that magic? You have to join my quick fix class. That's a flooding of concepts that occurs in 3 days. Usually it starts at 8 a.m. and it usually it has to end ideally at 5 p.m., but it usually would drag on until 8 or 9 p.m. But a lot of those who attend this class would usually tell me, well, I felt drained, but in a good way, because you're preparing us for the most difficult test that a nurse will take. Okay, so those of you who are asking how much is the quick fix review, it's for free for those who are enrolled in our test preparations classes. Okay, so it includes copies of my 3 books that are so valuable in terms of your preparations of your NCLEX. Okay, so during my review journey from comprehensive weekends review, where I was refreshed and was updated with new knowledge, now the comprehensive classes, if it's only during weekend, would last for around 3 to 4 months, but it's only for 5 hours per session. The good thing about that is that if you want to watch the replay videos, we'll give you the access. And then she attended the 3-day quick fix was the turning point for me. It helped me a lot to master the concepts in the easiest and fun way, which is the Gapuz way. They also let me access their course shell. I'm going to show you how the course shell would look like and how to utilize it and maximize the content for your test preparations. And of course, which is very comprehensive review material, I also want to thank God for his providence, for I believe that everything happens according to his will. To my husband, who's been my pusher and #1 supporter throughout this journey, to my family for their unwavering support financially and emotionally, and to the RA Gapuz Review System staff, mentors, and to Sir Ray for being the instrument for this achievement. Just trust the system, the Gapuz way. I am a USRN now because of you. Thank you and God bless. Thank you very much, Jim P. Villa, for the very, very kind words that you are sharing with regard to your experience coming into our system. Okay, and the third concept that I am about to discuss and to share everyone for the specific set of concepts for our NGN pointer set number 28, Eardrop Administration. Now, the first step before you administer your eardrops is to position the client on the unaffected side. So when you have a toddler, you make sure that you explain the procedure in a manner that they understand. And for toddlers and preschoolers, you have to give them a sense of control. How? You have to ask them if they will receive eardrops in both ears, meaning the left and the right ear. Then you have to ask them, which ear would you want the eardrops first? Is it on the left or on the right ear? And you have to ask that question to enable them to have a sense of control. And the most important thing is explain the procedure in such a way that they would be able to understand it. Now, there's a specific guide when you are to administer eardrops to toddlers. If the toddler is below 3 years old, then you need to pull the earlobe down and back. But for children who are 3 years old and above, you need to pull the upper part of the ear up and back. So below 3 years old, down and back. 3 years old and above, up, upper part of the ear and back. And then administer the drug along the side of the ear canal. And of course, you have to let the child assume the position for a couple of minutes such that the medication that you administered should be or must be absorbed before the child turns over to the other side. Okay? So it's very important to note those things. And we'd like to congratulate our NGN passers who are now numbering in the thousands around the world. So give us a ring at the Ray Gapuz system if you want to join them. And of course, if you want to study with technology, we're the only review system in the world that creates our system of tools that have been proven effective across all races in the whole wide world. Okay? So I asked one of our students which part of our review helped you the most. This is what he has to say. Bootcamp, sir. But overall, the functional concepts and the syndromic approach, those were the things that really helped me, especially for the difficult questions. Plus, quick fix and core shell. These serve as my booster for me, okay? And he said that in Filipino, okay? So this is actually the boot camp, and the next boot camp is gonna happen again at the Mount Crest Hotel in the city of Pines, the summer capital of the Philippines, where the weather is very conducive for learning. It's gonna be from January 8 to 2024, and that's gonna be exclusively with me, okay? Your mentor, your fact check buddy, Ray Gapuz. I'll see you. And this is actually the core shells that we are offering. If you want to avail of this separately, you have unlimited access. All you have to do is to open it. And each part of the core shell has a specific lesson. So you can do short quizzes, long quizzes, NGN tests, NGN videos, content videos, name it. We have everything in our core shell. So the most important thing is when you're preparing for the NCLEX review, you are supposed to stay in a conducive environment because it should keep your focus. It will help you retain concepts. And we are proud to say that at the Ray Gapuz system, we maintain our classrooms as conducive as it can be with our very reasonable fee. And of course, we're the only review system in the world that has our own NGN simulation room. They don't have it. We have it. Okay, experience the difference with the Ray Gapuz system. So may I invite you to avail of the next generation NCLEX RN Flex, the most flexible test prep class for the NCLEX RN. So you have your choice for live face-to-face class, live virtual class, on-demand and limited video recorded lessons, QBank and 3 books, NGN strategies and sample questions from me, and of course, your quick fix sessions. The fee starts at $3,499, inclusive of 3 important books. No need to buy them separately. So, once again, this is your mentor, your fact check buddy, Ray Gapuz, joining you for our NGN session number 28. I'll see you in my next video. Take care and God bless you.